I am also learning. We all learn together. This will be really helpful to treat for the sick community. Now, the most imperative point, empirical point, to be known as a Fench. Fench means is the gallbladder 20. Feng means is the wind. The Chi means is the pool. The pronunciation is Fench. So gallbladder 20, the point is located. Exactly we try to find out 2.3. 2.3 chon lateral to the posterior midline of the hairline, and then half chon above the posterior hairline. So now I wanted to select, this is the posterior hairline, this is the posterior hairline, this is the posterior midline of the head. From here 1.3 chon lateral, 1.3 chon lateral from the posterior midline, half chon above the posterior hairline, the point to be known as a Tian Su. Tian means again it is a heaven. That is a UB10 point. From there, 1 chon lateral to the Tian Su, UB10 point, that is Fench. That is the posterior and inferior to the mastoid process, midway between the origin of the sternocleidomastoid muscles and trapezius muscles. This is where exactly the point is located on the scalene muscles also. So now this where the scalene muscles, exactly we insert the needle is GB20, is the day-to-day clinical practice we uses this point. Now this is the 1 chon, again it is the 1 chon, 2 chon, 2.3 chon. Now I am inserting this needle in the many directions. I wanted to insert this particular point to treat for the vision related disorders. This point is one needle towards the other eye. So many directions you can insert the needle, this particular point. So since you can treat for this point to all the sense organs as well. There are the certain points in the body that all the 5 sense organs can be treatable by activating the single point, that to be known as a Fench. Now I just applied because I wanted to treat for the right eye, so I applied on the left side of the needle showing towards the right eye. Then I wanted to apply towards I wanted to show this needle. Now I am applying the needle towards the nose as the perpendicular direction. Now I wanted to apply towards the other neck region. I just applied this needle towards the other neck region. Right? So therefore now I wanted to apply perpendicular, as generally I wanted to apply perpendicular, I applied the perpendicular. So I wanted to apply towards the tongue related problem. I just apply the one needle towards the tongue in the other direction on the lower root direction. Now you just understand, because the one acupuncture needle, the 5 different directions can be manipulated. Since there are the 5 sense organs are there, in the 5 different directions can be treatable. Because when I was studying in China, that time my Laosha told me, when you wanted to understand that any brain related disorders, there is the brain problem it causing, there is one is the external problem, the other one is the internal problem. When the internal problem, there is the phlegm is accumulated, that's called as an insubstantial phlegm, that to be come out from the brain. When you wanted to use this particular area itself, this particular places itself in the occipital region, the wind enters to the brain. So you wanted to withdraw this, and they asked me to apply the needle and then withdraw the needle very rapid level. So when we wanted to close the hole, that means we are providing the energy. We wanted to destroy which is unwanted, chi which is accumulated because of the external environment, or the wind is excessiveness, the monsoon is excessiveness, the fan is giving the more the air energy, or when we travel after taking the shower immediately, the wind get exposure to, especially on the back region. We don't use the full helmet, that time it get open. So certainly numerous factors to reason to cause the problem. When we protect this particular area, we protect the ear system, definitely the ear, and then this occipital region we protected, the entire head to be protected. Even the hemiplegia, paraplegia condition, the people who are suffering for the facial paralysis or the paralysis, that condition also, where the wind is entered rapidly through this particular region. Of course, the person is suffering for the hypertension or the severe blood pressure condition. That time also, when you wanted to minimize and reduce the BP, also advisable to give the pressure to these particular points. Certainly when we activate these points, so generally by keeping this kind of the pressure, we activate the GB30 clockwise direction and then anti-clockwise direction. Certainly the patient feel lot of changes. So once keep doing the same, that the patient is suffering because he don't get sound sleep as well. He'll get the sound sleep, at the same time his blood pressure also will comes down, but naturally indirectly that will communicate and supposed to the pherenic nerve and also supporting to our cardiac system as well. So hopefully you understand. When we wanted to treat, sir, tumba ನೋವು ಆಗ್ತಾ ಇತ್ತಾ ನಿಮಗೆ? ನಿಜವಾಗ್ಲೂ ಹೇಳಿ ಸರ್. Now we wanted to pull that needle. So now slowly you just take out, that's not really good. So how to do that procedure? Immediately you just pull. Somebody do that procedure. Bunny. So pull the needle very immediately. Then if it gets bleeds for 1 drop or 2 drop, that also good. So don't use the cotton, but however keep it cotton is the safer side with you. Then you just don't press it, pull the needle, don't touch. Yes, very rapidly pull the needle, place it on the container. Good. Good. This is the way. This is the way when we want. Now you just check whether it is more bleeding is there. Then you try to place it some swab. If there is no much bleeding or 1 or 2 drops are coming, that also let it be there. Otherwise, if you can, without closing, we just leave it. The person who are suffering for the occipital headache, the vision related problem, or there is the neck related issues, then vertigo and giddiness, and this is in fact is the one particular point treatable for the hundreds of the head related diseases as well. The master point which I told you out of 20 points, so a few points are really imperative. Among them the gallbladder is the top one point to treat for the head related disorders, because this communicating to all the directions, this treatable for the lesser occipital nerve. At the same time it is the greater occipital nerve as well, that's communicating to the vision system as well. When the scalene muscles get the rigidity, and then the SCM muscles will get rigidity, and upper trapezius muscle stiffness, which causes the cervical pain, which causes the shoulder brachial syndromes. That particular time you wanted to release that kind of the stress on that particular region, which is unwantedly it is accumulated. Certainly the patient feel lot of changes. If you can't apply the needle, somebody wanted to use this point, ask them to apply the pressure to that particular region every day, morning 2 minutes and evening 2 minutes. Whenever with the focus, with the intention, close your eyes and then apply the pressure gently and smoothly, clockwise and anti-clockwise. Patient feel lot of changes. If to be done, this is for the span of around 10 to 20 days. Patient feel more relaxation, his blood pressure also gets controlled. Do you know the location? Everybody knows the location. 2.3 Chun lateral. If you have that doubt, somewhere maybe perhaps you are touching to somewhere else. Tian Su, that also heaven, the window of the heaven point. You can use that UB10 point, GB20 point, that area is recommended. That area is recommended. If you wanted to use the gallbladder, 12 also comes to that direction. Even all the 3 points. One is the Yemen is the DU15. Right, DU15, and then Tiansu, and then Fench, and then Wangko. These are the 4 points are good point to treat for the one direction, treatable for all the brain related disorders. Keep doing activating to that particular area. Certainly the patient feel amazing results. Every now and then it is required. So anyone having the doubt out of it?